We're down at the Thunder Bay District Health Unit, and we're here to tell you there's a few changes happening here at the clinic for the immunization day on Wednesdays, but we're going to get to that very shortly. We have Darlene Bennett here with us, Manager of Infectious Diseases. How are you doing, Darlene?
Great, thank you.
Excellent.
Busy time of the year.
It is, isn't it? Now I know people are going on holidays. People, well, there's all kinds. Kids are back in school, so there's all kinds of immunizations going on. Do you want to tell our viewers about some of the different ones that are happening here?
Absolutely. Well, here at the Health Unit, we have a number of immunization services. And which we're very proud of all of them. Firstly, we have our school immunization program, where we go into every school in Thunder Bay in the district to provide boosters for children in senior kindergarten and in high school. And then we have our hepatitis B and meningococcal vaccine program in grade 7, our human papillomavirus vaccine program in grade 8, and now it's been expanded to high school. And whilst flu's coming up.
Yep.
So that's another big season. We actually provide 2 clinics here a week. We have our Wednesday immunization clinic, which is now a appointment-based clinic, as well as our travel clinic every Thursday. Some of the new things that have occurred over the last probably year is that we are providing a pertussis combined vaccine to adults. So every adult over the age of 18, between the ages of 18 and 64, can get a government-funded tetanus, diphtheria, and pertussis vaccine. That's something new. That, years ago we only provided it to children. So now adults between those ages, if they didn't get it in high school, they can come in and get 1 dose of that. And right now that's particularly important because we have seen several cases of pertussis in the community.
What is that?
Pertussis is whooping cough.
Oh,
all right. So if you've ever heard of anybody that's had whooping cough and that very deep cough that they can't stop.
It's like a bark.
Absolutely. Yeah. Once you've heard it, you definitely know what whooping cough is. So that's something relatively new. So we're really recommending that adults come in and get that done.
What is the age range for that?
It's between the ages of 18 and 64 if you haven't had it in high school.
So I'd be in that bracket. Definitely.
Absolutely, absolutely. You can come in, and lots of people are in that bracket. The other change in our programs is with the human papillomavirus vaccine. Previously, we had only offered it free of charge to girls in grade 8. Now the ministry has expanded that to include girls in grade 8 as well as any girl that has not received the series in grades 9 to 12.
Perfect.
As well as girls that were born in 1993 and 94.
Oh, wow.
So we're covering quite a wide range of girls. So we're quite excited about that. So we'll be busy doing that program over the next few months. And of course, flu season starts next month, and we're starting with our flu vaccination program on October the 15th.
Now, before we get into those clinics, there's chickenpox as well?
Yes, we have chickenpox or varicella vaccine, and right now we're only offering it to children up to the age of 11, I believe. They should be getting 2 doses at least 2 months apart, or pardon me, 2 doses 1 month apart.
Now, we were talking earlier. How do you know if your children have had this? Is there a way to tell? Can they call?
Absolutely. They can call us here at the Health Unit. If they've been immunized at either one of our clinics or in school, we would have their record. If they haven't been immunized at the Health Unit, then we may not have their record. So good to call your healthcare provider.
So in the same token, it'd be great if you do go to your family doctor to call you guys and let you know that you've actually had different immunizations with your family doctor.
Absolutely. That's a wonderful idea, that if you get them done at your family doc or your healthcare provider, then you should contact us to give us the date so that we can enter it in our system, because often we get university students, college students here at the end of high school asking us for their records, and if we haven't got that information, then we don't have a current record.
Right. Now, this is kind of big news. In the past, the Health Unit here, every Wednesday, you could come to the clinic and get immunized and just kind of show up, and maybe you wait an hour, maybe you wait a couple minutes, but eventually you'd get in. Now, it's appointment-based.
Yes, we really looked at our client flow over the last several months and realized that you're right. I mean, in some sort of slower time periods, you could come in and get right in. Other times, like during travel season and flu season, you might be waiting anywhere up to 2 hours to actually get seen by a nurse, and often we had to cut the clinic off because we just didn't have the capacity to see everybody that was showing up. So as of last Wednesday, September the 12th, we have initiated an appointment-based clinic, and that we're hoping will, you know, decrease the congestion of individuals in the waiting room so that everyone actually does have a place to sit, as well as the congestion in the parking lot. I don't know if you've ever driven by here on a busy Wednesday, but we've got parking on the streets, and we're quite concerned about some of our clients. So, you know, we're hoping that this will be more efficient, clients will be happier, and, you know, when they contact the health unit and actually get an appointment rather than having to wait.
I love it. I'd much prefer calling, having that secured appointment, show up rather than just kind of, you know, wondering if you're going to get in. I think it's a really good idea. And we're speaking earlier, you've actually managed to, on one of your busiest days before, to be able to fit as many clients in with appointments.
Yes.
So
yes, we looked at sort of, you know, the number that we could see in that period of time, and we estimated that we could see as many clients that we could see, that we have seen in the past on a very busy clinic.
Excellent. Well, thank you very much, Darlene. We appreciate all of this valuable information.
All right, you're welcome. Thank you.
Excellent. So if you want to know any more about any of the information that we just talked about, you can head to the Thunder Bay District Health Unit's website. It will all be on there, I'm sure. Stay tuned. There's a lot more coming up on Shaw TV.